Stop it.
Yeah.
Okay.
Yeah, I think we're ready.
Yeah. All right. Good afternoon, everyone, or good evening. My name is Yasmin Piper. I'm the events coordinator for Spotlight PA. So for those of you guys who are new to our programming, Spotlight PA is an independent, nonpartisan, nonprofit newsroom producing investigative and public service journalism about the state government and urgent statewide issues. We make all our vital reporting available to the public at no cost through our website, spotlightpa.org, as well as sharing it with 95 community newsrooms who republish our work all across the state. And we can only do that with your support. So I'd like to pause here and ask for anyone who has the means to go to spotlightpa.org/donate. That's spotlightpa.org/donate. Your support allows us to continue these amazing events. So a few housekeeping things. We are recording today's event for those of you who cannot join us. You can view our event in the next few days on our website. For those of you who are joining us virtually, hello. If you would like to submit a question, please submit that at the bottom of your screen in the Q&A section, and we'll get to them at the end of the program. I'll leave to Danielle and Brittany.
Great. Hello, thank you so much for joining us. My name is Danielle Ohl. I am a reporter for Spotlight PA. And
I'm Brittany Haler. I'm the director of the Pittsburgh Institute for Nonprofit Journalism.
the two of us together spent, as some of you may have just heard, 9 months, the entirety of Brittany's pregnancy, working on an investigation into Pennsylvania's competency system and the way that people who are struggling with mental health issues are criminalized for that and often incarcerated. And how that system that is set up to help them once they're there often does just the opposite. And so, Brittany, do you want to introduce our panelists?
Sure. We have Tanisha Long, who is the community organizer for the Abolitionist Law Center. She is a rock star in her own right. She's also very spicy on Twitter. So if you want to follow her on Twitter, I recommend it.
Yes.
We worked 9 months to tell this story, and we had a really hard time contacting and finding someone who had been directly impacted by the incompetency system. And Tanisha was a ferry for us to find Rachel Bridgman, who ended up being the character in our longer investigation. So that's why Tanisha's here. We have Nev Jones, who is a mental health researcher and professor at the University of Pittsburgh. This panel was her idea, actually. Yes. She read our work, was very excited about it, and has been looking at this all over the country and is a little, I would say, perplexed maybe with Pennsylvania and is fighting the good fight. So we have her here. And then we have Jeremy Northrup. Did I say that right?
Northrup, it's okay.
Northrup, sorry. Who is a psychology professor at Point Park University. And he's here to also talk about the incompetency system and helped bring us here to the CMI. So that is everybody.
So thank you everybody for being here, and thank you guys for being here as well. We're really excited to get started. So we're going to start off talking a little bit about our reporting and what it entailed. We're going to try to do that really briefly, and if you guys have questions about it at the end, happy to answer that. But basically this all started with Brittany, because Brittany is very humble, but is also somewhat of a rock star in the region, kind of single-handedly a force for accountability in the criminal justice system, specifically in Allegheny County. She's covered, what is it, up to this point?
Yesterday is the 21st jail death at the Allegheny County Jail since April 2020.
Yeah, so since the pandemic started, you know, Brittany has been on the ground making sure that the jail is held accountable, and she really brought this idea to me because you want to talk about a little bit what you were seeing.
Yeah, so when I started really diligently reporting on the jail during COVID, I was speaking to men who were calling me from the jail. My number was written on a whiteboard somewhere in the jail, so I was getting, I'm not like dozens of calls a week. And they just were doing this due diligence of, here's how many people have COVID. This is who they're keeping on the pod. Like, no one was trying to talk to me about their criminal case. Like, word got out that there was a reporter who cared about what was going on in the jail. And they all sort of had this collective resistance, and they were being due diligent about it. They were taking notes and like telling me really like fact-based things. And then I would develop sources, and those sources started to deteriorate mentally. And then I would lose touch with them. And then I would find out they were on their way to Torrance State Hospital, which is where people get treatment once you are deemed incompetent by the courts. And I kept losing these sources, and then they would come back up after they had been to Torrance, or they would disappear completely. And I kept having that happen. And then I also know Tanisha, and we were comparing notes and talking. And so I finally, thanks to actually Point Park hosts the Pittsburgh Media Partnership, they gave me some funding to take this idea to Spotlight to facilitate a collaboration. So we are a very small newsroom. We are a micro newsroom. And
Yeah, we're
we
small,
have,
you're smaller.
yeah, we're like tiny, we're a 2-man shop. And so they helped us, you know, collaborate with Spotlight. And I came with this idea, and I was like, look, something is going on here. Like, these people are, once they get in what's called incompetent and they're waiting to go to Torrance, they get stuck, and I'm losing communication with them, and I can tell that they're deteriorating. This is a story. And then it turned into a 9-month.
Yeah, and I mean, this thing that Brittany stumbled upon, was really, we both wanted to kind of, get our hands into what exactly was the process for someone who had a mental health diagnosis or some other, diagnosis that, was impacting, their ability to understand the charges against them. That's what incompetency is, right? It's different than just your, average, you go to your doctor, they say you have schizophrenia, or you have some sort of depression or whatever. It's a step further. Once you are incarcerated, it ends up kind of, I don't know, shunting you into this whole new pathway, where we were able to get data from the court system statewide and kind of determine that people, while not everybody who has a mental health diagnosis is deemed incompetent, people that were deemed incompetent were often in jail for really low level stuff, things that experts say are usually perhaps a symptom of their health condition that is being, it's coming up in public. It might not have been a great time or a great day for that person, or they might be, housing insecure, economically insecure, something like that. And someone, noticed and got, spooked or scared or concerned and called the cops. And then they end up, stuck in this system that ends up kind of harming them or helps them because it takes so long. Those people that Brittany were losing touch with, we don't know for sure, but there is such a wait list and a backlog for Torrance State Hospital that people who, if they were, if they didn't have a diagnosis, if they didn't have this stamp of incompetent, might have just got their charges dropped, might have just gone to a hearing and it gets null pros, which is when the prosecutors decide that they don't want to prosecute. But because they had this diagnosis, especially in Allegheny, they were getting stuck.
Yeah, and the other part of this that comes into the Rachel Bridgman and where Tanisha comes into play is we had requested all of that data to figure out who had been deemed incompetent by the courts, and was this showing up in court documents? Was this on their docket, if you know what that word means? Because sometimes we use jargon and I'm not sure if like that's a layperson's term, but so it wasn't showing up in court documents. But then we knew there were cases where people had been deemed incompetent, but it was not being tracked by the paperwork.
Right.
So we knew that the data we had was like way off.
Yes.
And
it only had 23 counties in it, and one of them, if you don't know, Pennsylvania has 67 counties, so that's less than half.
Yeah.
And Allegheny, which is the second
largest
county in Pennsylvania, was not in the data.
Had zero incompetency cases in their court documents.
So we're like, what's going on?
So then we find out about Rachel, and you look at her court documents. Nowhere does it indicate that she was deemed incompetent. Nowhere did it indicate that she was going to wait for perhaps maybe months, weeks to go to Torrance and get her competency restored. We never ever would have found her had it not been for Tanisha and the incarcerated persons who had contacted Tanisha to say, this woman is dealing with this thing. She really, really, really needs help. And so it's really an incredible story in terms of, again, incarcerated persons contacting us and saying, here's the story. Here's what we need, here's what we know to be true, and you guys need to tell it. And they were right. They were, they weren't making it up. It was everything they said that was happening was happening.
Yeah.
So should I?
Yeah,
We
let's talk to the panel.
So again, Tanisha. And I was hoping before we get into Rachel's story, could you describe ALC's work and what a community organizer does?
Oh, wow. That's a great question. A lot of times when people ask me what a community organizer does, I just say everything. But that's not true. But essentially what we do in the Abolitionist Law Center, we are a movement lawyering firm. So what that means is the legal work that we do is guided and done with the community. So like the community doesn't tell, like we don't tell the community how to fight for their freedom. The community tells us what they need and we respond, whether it be through like community organizing or legal action. So the community organizer kind of connects the community to the lawyers, connects the community to resources, connects the community to the community sometimes. And basically that's my job. So I just have my hands in every single pot ever. And I just come up with off the wall solutions to problems that sometimes feel like they're just too big to be solved.
So how did that journey lead you to Rachel Bridgman?
So with Rachel's story, Rachel's story was absolutely upsetting. That's the best way to put it. A lot of times we are working hand in hand with our lawyers as community organizers. So one of our attorneys, Jackie, had come to me and she was so upset. And she's like, I have this incarcerated person I've been talking to. She said there's another incarcerated person who'd been banging their head off their cell wall and who hadn't been able to go out for rec time, doesn't know what's going on, no calls, no visits, no family, because those privileges have been taken away because she had mental health issues. The jail will decide that if you have mental health issues, you can't have a pen, paper, a tablet, phone calls, visits with your families. So this person was deteriorating, not just because they had mental health issues, but because of the conditions of their confinement. Mm-hmm. So by the time Jackie visited her in person, Rachel's face was swollen beyond recognition. No one in the jail had contacted her family. She was just there. Jackie got in touch with me and she's like, what can we do? And I was like, I don't know. If you can get me in there, I can figure something out. And that's what happened. Jackie took me into the jail. I met with Rachel, who like 2 weeks had passed between that conversation with Jackie and when the jail would actually let us see Rachel again. Her face was a little better. She was a little bit more coherent. And she told me, I know I have family somewhere. I'm originally from Georgia. I know there's family somewhere. She thought they were all dead because of her mental health state. And she's like, so if you could find them, that would be, maybe that would help. So I was on some detective stuff. I was, buying white page searches. I was like doing partial name searches. And this was up until like, we saw her at 5. I was doing this till like 9, 10 at night. And then I found a name that like matched kind of what she had told me. And I called the number and they called me back and they're like, yeah, this is Rachel's family. And that changed everything for her.
And then her sister got a bus ticket and came to Pittsburgh, showed up at the preliminary hearing and vouched for her and said she has family. Please, please, please let her come home. Please, don't send her to Torrance. It's going to make her worse. Please let her come home with us. And the judge let her do that. And that was right. But that was it took a whole system of just community people. This is an incredibly unusual circumstance that it's not
happen like that. It does not happen like that.
And then they called me and I drove across town to the hotel they were in, and Danielle and I interviewed her as soon as she got out of the jail, and she reported to us what had happened.
This was all right before Thanksgiving last year.
Yes.
I haven't been allowed back in the jail since.
Really?
No, they they for some reason I have to do a super background check now that has these parameters. They're near impossible because of Clean Slate Act. So it's like a whole weird thing, no one else has to do it. I'm like, did anyone else have to do this? They're like, no, we did that.
Breaking news.
I haven't been back into prisons.
So how common are situations like Rachel's, where people find themselves incarcerated because of mental health issues?
Very common. Mental health is, like, having a mental health issue is something that very much is criminalized. And a lot of the solutions for people who have mental health issues are criminal legal solutions. Like, if you are going to hurt yourself or harm yourself, the police show up. If you are just having a bad day and it's something that could be very easily explained if your family were here to say, hey, this person has a mental health issue, you might not get that chance. You might end up incarcerated. And once you get in there and you get inside the jail, they give you a ranking 1 through 5 of where they feel your mental healthiness is. And this is in Allegheny County Jail, just to be specific. Once you get that label, your privileges are linked to that. And once you start losing things, you start to lose your sense of self, your mental healthiness, you deteriorate. And then that leads to, you can't even go to court anymore because you don't understand what court means in their eyes. And it means that, you might end up in solitary confinement because you had a mental health episode that they felt made you unsafe for yourself and others. And I have personal experience about that. If you want me to talk about that now or later.
We will loop back, hold that thought.
And I was
Yeah,
like,
I wanna-
it's like, I think this is going back.
We're gonna come back to you, but I wanna bring Nev in at this point because, again, Nev Jones, an expert in this field, someone who has done this research for years. And Nev, I wanna ask you, your research really centers on this whole as a system, right? And where these gaps are coming in and why. So can you speak a little bit to, why is this the state of affairs that we have currently? And where are the gaps that allow someone like Rachel to be incarcerated rather than getting healthcare or help?
Yeah, absolutely. So, I mean, I think if we kind of go back to deinstitutionalization, what really kind of started to go wrong is that there was a promise, right? And ostensible legislation in place by the late 70s that was then immediately repealed under the Reagan administration that did promise a much more significant investment in community mental health services in the US. Never materialized, and arguably even the legislation that was repealed, the Community Mental Health Act, would not have come close to providing the kind of the level, depth, and breadth of services that would be needed. And things just have gotten worse from there as inequality increases, structural racism. Oh, is it a little hard to hear? So as we see kind of all these other societal problems, increasing income inequality, sequelae of structural racism, and increasingly kind of people kind of turning to substances, for example, to kind of cope with what are really kind of complex social political problems. What we see is a very large group of people in American society who are essentially socially abandoned, who end up moving between what has been referred to as the institutional circuit, ERs, acute services, hospitals, shelters on the streets, and then prisons and jails. And as you guys were saying, very often it's these very, very kind of small, kind of crimes of need and or in the course of initiation of an involuntary commitment order, so a 302 in here in Pennsylvania, that can easily escalate. For instance, if somebody is perceived to be resisting the police officers in question, this can very quickly escalate to charges. So this is how we kind of see this kind of path towards criminalization. And then because community services are not there for folks, even if they're released from jail or prison, there's a huge problem of kind of lack of housing, lack of affordable housing, and really kind of lack of more intensive community supports. So this is kind of where we're at. And I think these problems are consistent across the US, but there certainly are jurisdictions where you can go where you see much more investment in criminal legal diversion programs, really, really robust reentry services, so that help at least sort of mitigate what are, in a sense, deeper problems with the system and with huge shortfalls in funding and services available to folks.
Yeah, I wanted to really underline this. Hello, is that better? I wanted to really underline something that Nev just said, where this is a cycle, right? Rachel Bridgman, the woman who our story is centered on, when she was first arrested in Pennsylvania, she was actually released. Her first charge was dropped. That null pros that I talked about earlier, the prosecutors decided, for whatever reason, could have had not enough evidence, could have, something could have bungled in the course of chain of custody. They dropped it, right? So she was released and she took a bus, right, from the precinct over to, an area that had like a Boost Mobile and a Rite Aid. And she's from Georgia. She doesn't have anyone. She's, had told the people, even in the state that she was in, while she was incarcerated, that she had been treated for psychosis, in the recent past. And so she's cold, she's hungry. What does she do? She goes into a Rite Aid, and she told Brittany and I that she was like, I was just gonna start to shop. And there was a man that I was with, and he told me he would come back, and I figured we would figure out, how to pay for things. But I was so hungry, I was so thirsty. So she starts to eat, she starts to drink. They call the cops for a shoplifting in progress, right? This is a very minor charge in Pennsylvania. Usually it results in a citation, like it's a summary offense is what they call it. But because of her history, she's brought back to jail. And that's when the situation started occurring that Tanisha was referring to, where she really starts to break with reality. She starts to harm herself. So to Nev's point, this is a system that perpetuates harm. And that is something that we've found in Pennsylvania, but Nev, you've found it elsewhere. Is that right?
Yeah, absolutely. We see versions of this all over. Oh yeah, sorry. We see versions of this all over the US. It's just, I think there's a particular lack compared to at least some places I've lived and worked, in terms of kind of a really robust continuum of care and ability to really proactively engage and divert folks with what we call a serious mental illness in various forms. And the other thing I would say is that, absolutely, it's people are often experiencing repeat harm, repeat betrayal, repeat trauma. So across this kind of circuit, things are just getting kind of worse and worse, and trust in the system at a certain point is so fundamentally eroded that it also really kind of takes some pretty kind of exceptional people and programs to bridge that and reestablish trust.
Yeah. Oh, is this, no, hold on. Let's try. Okay. I think, oh, here we go. Got it. Okay. I want to at this point bring Jeremy in, because his work deals a lot with what Nev is talking about. You worked with folks who have been diagnosed with serious mental illness. You've been in support groups. So can you discuss a little bit about, what you've seen elsewhere? I know that you have some practice in New York, and what happens to someone when they don't get the support they need and they end up in a jail or an institution that's not therapeutic.
Yeah, so can you hear me well enough if I don't, the mic-ish, maybe I'll do it like this. So I think it's important to think about this experientially.
Yeah.
I think that, so here at Point Park, we have a human science approach, and I think it's really important to think about what it's like to be in this situation. And to really kind of dwell in the what it's likeness, the phenomenological perspective, really fancy word that you're going to get here tonight. So you can think of any number of people, but especially with serious and persistent mental illness, what would traditionally be called serious and persistent mental illness. And I also facilitate hearing voices groups that try as best as possible to get out what it's like to be living with these sorts of issues, experiences. Think about someone who's disorganized, completely disorganized, perhaps, maybe not, but they've done something and they're just trying to get food, whatever is going on, but they could be disorganized, they could be disordered, they don't really know what's happening, they're one place, they're being picked up by the police, they end up in another place, they end up in a jail, they end up in a psych hospital, and then the care is Torrance Hospital. And we shouldn't perhaps get confused. Torrance is not a place where you want to go. Just like most state hospitals are not places you want to end up. They're often very cold, alone, difficult places to be. You'd be confused. Again, you're being shipped off to all these different places. You don't know what's happening, both in a kind of objective sense, but also in an experiential sense. And then you find yourself, I don't know, being processed or being carted to like a deck for an assessment. You're being asked all sorts of invasive questions while you're not really oriented towards what we might call something like common sense reality. You're down on your luck, all these sorts of things. And it really nicely, it's like, if you're feeling suicidal or something, this is a criminal act in a lot of ways. Like you could be held against your will and put into spaces where you lose your agency. So you end up being, because you're having a hard time, you end up demeaned and degraded. And what I mean by demeaned is that you're meaningful, the systems of your meaning are no longer valuable. That you're actually like, you're not the language changes across states, but you're not a reliable reporter.
Yes.
What you're saying can be disregarded. You're encountering, not all the doctors, not all psychiatrists, not all social workers and whatever, because, many, us on this board are psychologists and have all sorts of different titles. But a lot of the time you're being kind of dismissed or being explained away. And these are the caring places. These are the hospitals. And so I think it's important to notice that these places are places where you can't have pens, all the things that you take for granted, like aloneness, the ability to have physical contact, the ability to commune with people in a way that you want, to not have the gaze of the hospital.
To wear clothes.
To wear clothes, to have shoelaces, like all these things that are really like we take for granted. They're all these tacit, implicit sorts of things that we take for granted are when you're at your worst, you get these things. So this is I think it's important to think experientially. You could call people psychotic, schizophrenic, whatever you want to say. But this is at your worst moment when you're in contact with police officers and psychiatrists and you're being moved to jails and you have cops and on and on. Like any of us, even at our best, which maybe we're not at our best, this would be a disorienting, demeaning experience where we would become undone. So then you end up in these places that are frankly far from caring places that take a carceral approach to both mental health and so the jail approach is given over to the hospital. These are places that are largely they're crisis based because they often have to be crisis based. They're not sorts of long-term exploratory facilitative respites. Places where you would actually be able to retreat and rest and find some respite and resolve and become differently. They're loud, people are screaming all the time, they're echoey. I mean, these are like really, this is the importance of phenomenology, the study of experiences, to really come into the experience of these spaces at your worst. And so lots of this stuff is just sovereign power. It's just a bunch of people moving people around and doing what the system wills with you, which is in and of itself an experience that is awful for anyone. But really, I want to point in, especially when you're in that frame of mind that is not. And then you have this a really fancy word, iatrogenic, where the care actually causes harm. So you're supposed to be getting care and taken care of, but actually what you're getting is more harm. And then you have an ongoing cycle, and I've talked about the institutional circuit. But then you end up not wanting to go get the care that's available, and then you end up isolated further, and then you end up, trying to stay away from these spaces, and then you end up in worse. So you either you're alienated into the margins of society, or you actually end up in the middle of it, and you end up in some of the worst places that exist. These miserable slivers of the world. Yeah. So I'd stick it on, I guess.
Which, to bring it back to Rachel's experience, she was self-harming. She didn't know where she was. She thought she could hear God. She thought her family was dead. And Jackie, who works at ALC, just talking to her like a person was enough to bring her back to reality. And then Tanisha, who are strangers, just talking to her like a person was enough to get her to give them the information to find her family. And then by the time I met her, which was, you know, she had walked out of the jail into a hotel room, she had a full conversation. She interviewed, you know, she was lucid. She was having a full, a completely different person from the person that I had seen photos of, that I had heard about.
Lovely.
And she was, I mean, brilliant. I mean, she was with her sister. They had balloons. They were hugging. It was this, you know, beautiful thing. Sorry. Ooh, but
We both hung up and I like stopped.
I'm still like,
It was rough.
but anyway, my point is that it's the moment that you look at someone and treat them like a person, it completely reshaped how she was. It wasn't that you needed this like major intervention. I mean, you did, but like it was just human contact that had brought her back to reality, and that's how we got her out. So seems simple.
It's,
You wanna?
I think, yeah.
I'm kind of left, but it's okay. I think a lot of what Brittany's saying is the core of it. Jackie was probably the first real human contact she had that wasn't ordering her around, that wasn't treating her like, just, excuse my phrasing, like crap. Jackie came in and she's just like, I just want to hear you and let you know that you're seen. And it's not like they talked about a lot. Jackie didn't come in as a lawyer. She came in as somebody who just cared that Rachel existed. And then she called me for like a little bit more help. And just by talking to Rachel, like you see somebody whose eyes light up when, you know, you want to hear what they have to say. She really just wanted to talk. Like it's not a lot. And I was immediately invested in her because that's just somebody. And that was enough for me. Like that's my baseline. Like, are you somebody that you deserve to be treated right? And just you saw her get better, like Brittany said, just by having people who cared. And then when she found out her sister was like in the picture, boom, you just saw like as soon as I remember the day we told her that we, you know, had gotten in contact with her sister, her smile, which I had not seen yet, it was just like, I almost lost it. And I think I'm a little thug. So I'm not gonna like start crying in a jail, especially not in front of a CO. But it was close. It was real close.
I think it's a call to care. Like, I mean,
Yeah.
this is actually, you know, a human science approach, like an actual ethical approach to tending to people actually facilitates like deep growth and change. Like it actually, you know, and it's sad, but in hospitals, you actually have to, you have to kind of, I remember I would go to the dance therapy groups. And if you wanted to remember that people were human beings, it was in the dance therapy group, you know, as people are doing these actions. And I would seek this out because, you know, if you're working in a hospital and, you know, it's a lot of work, it's a lot of stress, there's a lot of demands, you have to search out these moments. But if you can get in touch with the humanity of those spaces, like, and the meaningfulness that people, just because they are going through a difficult situation, it doesn't mean that they now get to be degraded or whatever. You know, if you can get in touch with that meaningful core, amazing things will happen. Smiles take place. You know, yeah.
We had mentioned that Tanisha had a personal connection to the way that incarceration can affect your mental illness, and I didn't know if you wanted to loop back to that.
We can do it. we can get into it. You know, me personally, I'm very transparent. Everybody who knows me pretty much just knows me because I'm an open book and I tell people way too much about my life. Huge oversharer. But what a lot of people know is that not only have I been incarcerated, even if it were for a brief amount of time, but my mother's also incarcerated as well. My experience with incarceration was brief, you know, but even in that time, I take Adderall for my ADHD, and I wasn't allowed to have it. They straight up said, we don't want this in our jail. So for 5 days, I'm just running around with my head going everywhere. And like you said, disorganized, disoriented. In my mother's case, it's a bit more severe. She's been diagnosed with schizophrenia. She's been diagnosed with dementia. When she was in Washington County Jail, she had a mental health episode. She believed that ants were crawling all over her. She believed that my brother had been kidnapped. It was so severe that they felt that she could not be in general population. So what they did was they put her in their medical unit under a restricted housing unit. And essentially what that was solitary confinement. She wasn't allowed to have a pen. She wasn't allowed to have paper. She wasn't allowed out of cell. She was in her cell for over 23 hours a day. But we didn't know any of this was going on because what they also did was they made it so that she couldn't call anybody and we couldn't call her. We couldn't get in touch with her on a tablet. So for a while, we're like, we haven't heard from mom in a while, which is weird because if you know anything about my mother, she will call and text 30, 40, 50 times a day, even from jail. I don't know where she got all the money, but she was doing something in there. And we just keep getting these jail calls. I mean, after a while, when you have someone incarcerated, it wears on you too, where you don't want to answer a jail call every 10 minutes, but then they stopped one day. And I'm like, oh, she finally was giving me a little peace, but then it stopped for a week. It stopped for 2 weeks. And then we started, something's up. At the time we were able to figure out what was happening. And by the time they let us have a video visit, she had lost a significant amount of weight. She was in a deep state of psychosis where she had no clue what was going on. Her physical health had declined because you also lose your ability to self-advocate and for your family to advocate for you because they can't see you. So whatever's happening to you inside that jail, it's just happening to you. And we did some interesting legal maneuvers to get around the fact that the jail refused to take her to a hospital, refused to let her out of solitary confinement. And right now she's actually incarcerated, but incarcerated at a nursing home, which wouldn't happen in Allegheny County. Washington County, handles things a little differently, where we have that window to be a little bit more creative in a way that made it so that I know she's at least safe, even though her mental health has been permanently damaged by that time in solitary confinement.
And I just want to emphasize that, while you thankfully, luckily, were able to find your mother because she had been so annoying and know about this. I mean, if it hadn't been for Tanisha and Rachel's case, there was no way to know. There was no way from the outside to know, because going back to what Brittany said about, every time you're charged with a crime, there's paperwork, right? And it's public, which is, it's nice for journalists because we have a window to kind of see when people are stuck, but it can also be damaging for somebody who then, has to get a job, get an apartment. But on Rachel's paperwork, on her docket, there was no indication that she was stuck, that she was incarcerated, because she was waiting for that bed at Torrance State Hospital that Jeremy was speaking of, which is not necessarily a place where you're getting care because you need to get better. In her case, it was specifically, and is specifically, it's a forensic hospital, right? That's what they call it. And those are for, people who are justice involved, unfortunately. These are the terms. It is so that you can go and you can meet a specific set of justice involved of criteria. Do you understand the charges against you? Do you know how to aid in your own defense? Which is, people have to have due process, and in order to have due process, they have to understand. But it's a broken system because it doesn't have connective tissue to what people actually need. It's just they're on a list so that they can go to this place, so that they can understand that they are in trouble with the law, so that they can go to court and potentially, go to prison. So, I want to bring it back to Nev because, you also have personal connection to the way that this system can fail. And I want to let you have the opportunity to speak a little bit about that as well.
Yeah, so I mean, again, similarly, both kind of growing up directly entangled in multiple systems with a parent with schizophrenia, and then myself personally, after the point I was diagnosed. So I think kind of everything that everybody has been describing and Jeremy's illustrations of this, right? It's absolutely so much about treatment for quote unquote SMI is just dehumanizing at its core. And you know, in my case, I had a lot of second person exposure growing up, but even that did not prepare me for what it feels like when you're the one going through systems being treated this way. And I think with psychosis or schizophrenia in particular, there really is this kind of deep form of testimonial injustice, epistemic injustice, that nothing you're saying is believed, nothing you're saying is taken seriously. And being treated like that repeatedly does not make you want to engage with the system. And I guess what I would loop this around to, you know, I mean, we're gonna have Q&A too, but it's sort of kind of a plea, right? That we need to kind of come together as a community to really fundamentally change mental health services, to fundamentally change the way that we respond to people, and kind of what has become a normalization in society of social abandonment to these broken systems, and then, you know, at worst, jails, state hospitals, prisons, these kinds of institutional facilities. So it really is as bad in a way as we are making it out to be. And for an awful lot of people, these are not outlier cases. This is more typical than not, and for people in the United States who end up with a schizophrenia diagnosis, for example.
I don't know if you have any concluding thoughts, or if you wanna kick it over to Q&A.
That was a great group set.
Yeah, me too. I think it's important to kind of, I think it's important to underline, you know, that we've heard from folks across the system here, not just people, you know, journalists and activists and researchers and academics who are on this panel, who you might, you know, assume kind of come at it from one lens. But I mean, part of the project that Brittany and I did, we attempted to survey all of the jails in Pennsylvania on this. And we were, at the beginning, we were like, we're gonna get like 2 responses, right? We got 33 responses, and pretty much every single one of them were a cry for help.
Except delegating 9.
But I'm sure they didn't respond.
They said they were doing great.
They stop. They, you know, so some of them, a couple said that things were, they gave something a 4 out of 5 or a 5 out of 5. We gave them a scale.
Yeah.
But most of them were really overwhelmed. The answers from the wardens themselves were that we're a dumping ground, that we're being seen as a place to just give the people who no one else wants to deal with. We are a jail, we are not a mental health facility, and yet we have had to scale up our, you know, budgets in the last few years to do this. And so I just want to emphasize that it's kind of a problem that like everyone agrees on at this point. Even the people that are in the justice system, you know, we spoke also with a chief of police in Elizabethtown, Pennsylvania, who really had to kind of take it upon himself to be like, none of this is working, nothing is working. And so kind of cobble together resources from different grants to try to get peer support instead of officers to respond to people who are in crisis. But you know, that's only at the point that they're in crisis, right? So yeah. I think now we can kind of take questions. I mean, yes, I don't know if we have questions online, but if we want to pass to people in the audience.
Yeah, we definitely have some online questions, but does anyone in the audience have any questions? Go to our.
A lot of questions.
Yes.
In your dream world, because we're all visionary, how do you see the design of the ideal process? Where do you start?
We can't get to the expert.
Too big of a question.
You can go first. Sure.
No, it's not. It's a good
The
question.
journalist angle for that, which is transparency.
Yes.
The journalist angle for that, I think, is transparency, documentation, open communication, allowing families, the public, whatever, access to the information of the people that are housed in these conditions, who is on the wait list for these hospitals, who tracking them across the state so that we could know the demographics of it.
Yeah.
No one is tracking this. It was one of my like obsessions when we were doing this project was what is the racial makeup of the people being committed to these state hospitals? What is the age makeup? What county is committing more people than other places? They don't know, or they didn't give it to us. But there's that to me is a dream world would just be access to the information. Which is I know, but I'm not an expert psychology speaking, you know what I mean? I'm gonna let them do that, but like from just the reporting perspective, I would think us being able to access all of that information would be great.
I'll give the quick activist answer. I mean, my first number one thing is you have to remove the carceral element from it. So when you begin approaching a mental health crisis or mental health issues as a situation that requires police intervention, you've already stepped off on the wrong foot. That's one. Two, once you get into a jail, you know, there's a process, at least in Allegheny County Jail, where you have a behavioral assessment unit, and they decide whether or not they believe you're competent. But once they make that decision, it's not like it's revisited. It's not like people are going back to see if that was the right choice. You're just stuck on that Torrance waiting list. A lot of other jails in the ACLU has sued like the state of Texas for this. They have mobile competency restoration units. They partner with the community and community services to make sure we're getting people, you know, the help, or I hate this word, but the correct labeling, so that people aren't just sitting in jail. And there's a million other aspects to just the Allegheny County piece because they do everything wrong there. They really are harming people in a way that I think, you know, I would be surprised if they made it, you know, another year without being sued out of existence. But those are just small steps. But it starts with not incarcerating people for having mental health issues, but then also partnering with the community to provide the resources if we either A, get to that point, or B, start taking preventative measures so we don't get there.
Yeah, so I would add that, you know, the carceral, thinking about this as a carceral issue, I think we should link it with a medical approach. Like, so the medical model in and of itself kind of thinks of care as a relationship between the drug, so psychiatric first sort of worldview, thinks that medical care, psychological care is a drug and a diagnosis, or a manual and a diagnosis, rather than a therapist or a person and a person. Like, and I think that would be it's kind of, it sounds silly, but you have to think about it as two experiencers with one another. You have to think about that. Nev says epistemic injustice, and this is exactly what it is, that we have a fundamental right to make make meaning. You know, someone is taking away your ability to construe your own experience. And it might be far out and outside of common sense, but that's the start of, you know, so it's not someone isn't schizophrenic. I mean, that's might be the way we understand them, but they're a person who is struggling and striving to make some sort of sense of a space that is completely chaotic, completely undoing. And you need to be able to affirm that and exist in that space so that you both epistemic injustice, surely, but that you think of this person as transcendent or more than or other than just the diagnostic category that exists within, I don't know, the brain or something like that. You know, that they're a whole being, a whole experiencing being, a feeling being, a sensing being, with a history and a life and a relationships. And that if you isolate those people from those spaces, it shouldn't be like rocket science that they don't get better.
And
So I don't know if,
I want to add that, you know, to Brittany's, you know, point from the journalistic perspective, yes, we always want more access to data, but we also, you know, in the course of doing this reporting, we couldn't get to everything because this is such a wide system with so many problems. But one of the things that did come up when we would ask, well, where are people doing this better, if they're doing it better, is, you know, a diversionary model. Like, let's not even let it get to justice in the first place, because then we're already, as Tanisha said, we're already losing. We're already starting off on the wrong foot. And you know, after the story published, you know, Brittany had her baby by then, so I was kind of like, I will bring this other baby across the finish line. So true. It is true. And so I was talking to, after the story published, I was talking to some people just because one of my things my editor asked was your question, like, okay, so what are the solutions? Like, what can we tell people to do? And the more I talked to people, the more they were like, well, there's not really anything anyone can do because the community supports don't exist. But what came up over and over was that if someone appears to be in need, there needs to be public education about how to not call the cops. And that is sometimes not an option, right? Sometimes you don't have anything else in your community or you don't know what else to do. But it has come up and I've been continuing this reporting, since then, it's just on the gaps in the system and why this has all happened. But increasingly people just say kind of like there needs to be education about what the alternative is because we don't have one.
Yeah, and just to echo things that people have said, I think, a narrow answer is that there is community-based competency restoration. There are models for this all around the country. And so, if there are mental health courts, competency restoration diversion systems, people can be swiftly diverted back to the community and either charges are dropped because they're not actually that serious to start with. And then competency restoration can proceed in the community because going to a state hospital, as Jeremy has said, is not, and people get stuck there, right? So if they're unrestorable, that's the term used, they're not in some states, in some state hospitals, it could be years or even decades before they ever get out, regardless of what the charges were. So there are those pieces that are like, how do we kind of reform the systems we have? And then there's deeper questions about what sometimes get referred to as non-reformist reforms. And that is really an unworking of these carceral logics, I think, that don't just undergird prisons and jails, but literally hospital-based response, mobile crisis response, involuntary commitment as this go-to option for people experiencing psychosis. And we really, really need to, I think, kind of take a step back as a society and ask ourselves why we think that that is an appropriate response to crisis. When I've done quite a lot of research around the impact of coercive experiences, right? And so when somebody's experiencing, this is even youth and young adults entering the system for the first time, if their fundamental experience is one of punishment, judgment, moralization of distress, or the variety of meanings they might attribute to what they're experiencing, that is fundamentally and deeply wrong, and we will never get to justice until we can do things differently. And we have to train our clinicians, our social workers to really kind of think differently about how they approach people. And that's no easy thing because this is so kind of baked into culture at this point.
Even one of the things we never got to, I wonder if we're gonna say the same thing. We have a whole Excel sheet of just people arrested at an emergency room.
From hospitals.
People who had gone to a hospital seeking in good faith help, who had either attempted to hurt themselves or whatever, they were scared and then they lunged at a nurse, they said something inappropriate and then they were incarcerated for it. We had an entire spreadsheet of just stories of those. And it was too big for us to even tackle.
Because hospital systems, a lot of them have their own police forces.
Yes.
So that's how we were able to
Yes. So if there's a journalist out there who's watching this and interested, do that story, please, or somebody, because we never got around to it.
Was way louder than I thought would be. The quickest note ever, when it comes to mental health courts, one of the biggest problems with mental health courts is you have to be guilty to be in a mental health court.
It's still a court.
It's still a court. It's still part of the carceral system, but it's not diversion. Like a lot of people view it as like, oh, well, you can just go to mental health court instead. You still end up with a conviction. You still end up in the carceral system. So even that's something that we need to, completely look at the way we're doing that, because that in itself, you're still criminalizing mental health. You're just criminalizing it light. in the eyes of some people, but honestly, a lot of the constraints of mental health court make it so that you're still trapped in the court system for years and years to come, and your mental health diagnosis is now a part of your criminalization.
Any other audience questions? Yeah.
You don't, you can repeat it.
Okay, yeah, I'll repeat it.
This is actually more of a comment than it is a question, but I was an intern at the Abolitionist Law Center. I specifically worked in mental health court, and I have started my own separate research project for mental health court here at the school. And personally have found that it is very much a glorified drug and alcohol court. That focuses not at all on mental health. They really only care if you're taking your medication, and it never is brought up like anything that is brought up with these people, because yes, they're seeing psychologists, they're seeing psychiatrists, but it's never actually talked about. It's just making sure they're going. Not
It
there's
being
progress.
their mental health.
Right.
Yeah.
It's never about their mental health. It's whether they're clean.
Mhm.
And I've seen such embarrassing things happen to people at court, like being drug tested in front of everybody, which, you know, is not something that is helping your mental health.
So just to repeat, she's saying that, you know, she was an intern, or sorry, pronouns?
She, her.
She, her, okay, great. She's saying that, she was an intern at ALC and is now doing her own work, to, you know, a research project here at Point Park?
Yeah.
Okay, to look at mental health courts and finding that they are not, in fact, really about mental health as much as drug and alcohol. And very dehumanizing things are happening to people, like somebody was drug tested in front of, you know, in public. So that is really helpful, and we will follow up with you after.
Oh, good taste.
I would just add to that too, medication adherence is typically baked into the mental health court
Right.
system. And you know, I think of medication adherence is one of these like real vectors that drives disengagement. And also medications are treated, as Jeremy was saying, as this like single story, right? Like all that we want out of this person is compliance with medications. And that is extremely, extremely alienating, dehumanizing, strips people, right, of their human rights and their agency. And so again, we kind of do all these things that actually really kind of push people away and kind of push them into a place where they're really kind of desperate, trying to survive and survive in ways where they feel the system is offering them nothing. So I think those two things are other aspects of the system. I mean, it's sort of right, like the drug and alcohol compliance abstinence mentality, and then the, you know, medication compliance, which is really, really deeply problematic.
Right.
Yeah.
Do
Should I take that microphone?
Sure.
I actually really want to just ramble, but I'm not going to do that. I will just say that nothing that you've said is surprising or different than pretty much everywhere else in the country that I've looked at. I talk to people in prisons here who want to comply with their drug regimes, and then they get accused of spitting their Suboxone into their pocket or diverting their supply, and then they get it taken away. So it's like the punitive dimensions just go all the way down. It's just punishment all the way down. I'm not going to ramble. I just want to ask, in Allegheny County, are there non-carceral, non-governmental systems in place to address the challenges that you're discussing? And is it possible to find someone? I live in Squirrel Hill, and there are certainly tons of people who could use care. I would never call the police in a million years. I would do anything I could not to. But are there people that we should know about, or places that we should know about, where people can get this kind of care? And are there models nationally of systems that actually do a reasonable job that we as Allegheny County residents or Pittsburgh residents could advocate for to our leaders who we see in Eaton Park and at Giant Eagle and all the other places that we see them. So I'm just curious about those two things.
You don't want me to answer that.
Yeah, so I mean, I think we really need alternatives, especially, I mean, Jeremy can talk about bridge outreach. So I think when it comes to kind of harm reduction, we're in better shape in Allegheny County than when it comes to somebody experiencing, for example, acute psychosis and what is there for them in Allegheny County. And, you know, this is my area of specialization and expertise, and I could not recommend any place. The first episode psychosis program is great, but people have to be within kind of a narrow window. In terms of national models, there absolutely are a lot of them. New York City is like kind of a really rich source of very kind of progressive community mental health agencies and organizations doing a host of kind of really alternative work, including there's a variety of ways in which New York State has tried to create alternatives to AOT or to assisted outpatient treatment. It's a longer term version of involuntary commitment. And, you know, so I think that we can kind of look to these other models, but you need funding, you need resources, and you also, the human element is really important. You need providers, clinicians who are willing and able to really engage with people in very different ways that are the antithesis of all this sort of dehumanizing control mentality, judgment. All you have to do is take your meds. We just want you to take your meds. Everything revolves around that story. And I think that requires really kind of a shift in how we're training kind of the frontline mental health workforce, social workers, peer specialists, even counselors, et cetera. And so there are models, but there's also kind of things where we really need to kind of shift training and culture. It's not just the model, but it's also the people who are implementing it.
So for a long while, I did a lot of research with Operation Safety Net in Pittsburgh, and there's lots of street outreach for people experiencing homelessness. That's a pretty unique aspect of Pittsburgh, I don't know, ecology of care. And so whether it's Operation Safety Net or Bridge Outreach or it's Prevention Point, there's a lot of, if you end up on the street or precariously housed, there's a lot of relationship building that's happening in people experiencing homelessness. I think Nev is right to say, once you, like, what does it look like to do a kind of total care? What does it look like? You know, if someone on the street is in the throes of some sort of mental health crisis, we see Resolve. There's largely, that's the crisis response team. And you know, sometimes it's confusing to people about, you know, if the police are going to come or if they're not going to come, and you know, there's co-response things, and you know, Resolve is downtown now too. And so there's all sorts of, you know, I think Pittsburgh is a place where there's a lot of fomenting really kind of innovative and progressive, I don't know, revolutionary sorts of ideas actually. And there are programs, you know, not just as a Point Park professor, but Duquesne University is doing great things. Nev's at Pitt, and there's lots of energy around. And this, you know, Nev and I are chatting constantly about how it is that we can make and build these, not only as researchers, I mean, because both of us are researchers, but as a clinician. And then I can also, you know, instill this training in doctors who will stay around here and have a human science approach in the city of Pittsburgh, and will be able to be in these places where psychology is happening, whether they be in community mental health places, that they can actually advocate in a human science sort of way for a less dehumanizing, less demeaning. But the short answer is there's not really like and I think, I don't know if you agree now, but like there's not really a number to call that is going to give you this kind of holistic, humanistic, phenomenological experience near respite care here.
I was laughing when this question came up. I was like, you don't want me to answer this. Because, you know, me and my circle, we don't call them. It's just not our thing. And one of the things you brought up was like a lot of it's being done by the community. And that's our answer right now. It's a lot of community groups who are getting there, doing the work, who share each other's numbers, who reach out on signal chats or wherever they're doing it. And that's how we're responding. We have people who do work with the unhoused, community care and resistance in Pittsburgh. They've been doing it every Sunday, just hitting the streets. And it's because we understand that, you know, some of the groups that start out looking for funding because they plan on approaching mental health differently, as soon as they get in bed with like the county or they start receiving funding from the state, they start being bound by their rules, which often, you know, restricts what resources they can use, which restricts the way they can respond, which makes it so that they have to call the police. So these great ideas start, and people start programs, and then those programs get in bed with the county and the state. And once you start getting that county state money, you stop being the program you started as. So my answer is the community's doing a lot of the work.
So how do you find, like, how would I, if I'm walking down the street and I see someone not in acute crisis, but needing support, how would I connect them to these groups? Is it possible, or does it just have to happen by chance?
I can see you after this.
I would also say real fast, so Nev and I are both hearing, so we're Hearing Voices Network facilitators, and Hearing Voices Network is a peer support group, and both of us identify as having experiences that would be, so it's peer support, you have to identify as having those sorts of like a psychotic spectrum, you know, experiences or whatever. And this is something that I've tried, you know, get trained here, and Nev has experience in it, and actually we're just talking about it before this panel, that we need, there's students who are interested in doing this, and that would be something that would be a kind of a diversion, I guess, or a different way to understand one's experience, that you'd be able to find. There's a whole movement across the country of people trying to understand their experience near. Yeah.
Sure, I think we have another audience question, but I want to real quick here, if you want to take Jeremy's. I want to real quick address a question that we got online, which is kind of from a law enforcement perspective, like what do they think about all this, and why don't we have someone here from a law enforcement perspective? And you know, this is a panel that we are particularly trying to talk about the experience of you know, people who have mental health issues who are incarcerated. Tanisha does a ton of work with that, and so do, you know, Nev and Jeremy. And you know, it would be great if we could have 70,000 stakeholders here, but you know, we have us 5. I can speak to the reporting that Brittany and I have done, which did include people, like I said, wardens of 30 jails, right? People who are providing care at jails, police chiefs. You know, one of my great sources is used to be an executive director of Pennsylvania Chiefs Association, who connected me with the chief in Elizabethtown, who told me, you know, it took me a while, but I came to the realization that when you're trained to be a hammer, when you're a hammer and that's the tool you have, everyone looks like a nail, right? And so when you are an officer on patrol, you're the only one at 3 o'clock in the morning, and someone calls you, you're not a peer counselor, you're not a therapist, you're not a psychologist, psychiatrist, you don't have, you know, you're not a social worker, right? You have the tools you have, and that's handcuffs. This is what the police chief was telling me, right? And that comports with kind of what we heard from folks who are in corrections. They are not on board with this either, right? You know, I'm sure everybody on the panel has different experiences with, you know, the dehumanizing behavior that can occur in, you know, at the hands of police and at the hands of folks in, you know, COs in a carceral setting. We have colleagues who have done reporting on that, right? We have not done reporting on that, but we know, I mean, Brittany has, I haven't, but, you know, we know what can happen. But just in the context of this reporting, of this investigation, you know, we have spoken to people in law enforcement who also feel that this is not a system that serves them. So, you know, I hope to whoever is watching that is helpful to you. You want to comment? Yeah.
I do want people to also understand that not everyone feels safe around police. So, you know, with the sensitive type of panel we're talking about, for some of us, it would feel deeply uncomfortable or even unsafe having to sit here by a police officer and, pretend that I'm okay with their presence, but also get into a situation where they're either trying to justify the means that are being used. Or I would just feel like I'm spilling the secrets. And I'm really not about to sip tea with a cop. So, I mean, cops don't make everyone feel safe. And I understand that's not everybody's experience, but I appreciate this being a safer space. So.
Maybe another audience question. Okay, yeah, go for it.
Yeah, hey, well, it's not a question. I just wanted to contribute that like the idea that we need other people to come save us is like how we get the police. It's like this outsourcing to like the police, to mental health professionals, to all these strangers who don't know who we are and don't know what we need. And like a lot of the people in our lives or like in people's lives around people who are have mental health issues often kind of sometimes they're not helpful to people at all, but like oftentimes they do know a lot of what the people need, but they don't have the capacity and they don't have the money. And so giving people money and giving people like just the space and the time. And like a lot of times people have mental health experiences outside and it's just like, okay, you happen to catch it. It's like really none of your business. You can keep going down the street. There's a lot of times where it's like not even relevant or like your business. And like the other thing on that is like if you're watching somebody experience something that you don't understand, that doesn't mean it's a crisis just because you don't recognize it. But it's also that if you don't know somebody, then it's of course you're looking for somebody to call, like something to do because you don't know them. So if they're in your community and you see them all the time, maybe you can just like get to know them, and then maybe you have an idea and a sense of what they mean because of what they need because maybe they like tell you. So just want to contribute something.
Yeah, thank you so much for that perspective. And I just want to really reinforce what you're saying because Brittany and I did analysis of the data that we got around this population, which we know is incomplete. And we saw that a lot of the vast majority of the things that these folks were incarcerated for were really minor, and some of them sound scary, like a common charge in Pennsylvania is terroristic threats, which sounds like terrorism. It is not. It is a low-level misdemeanor, and it basically just means that like you scared someone or potentially had that, like you potentially could have scared, like it can be so minor. It can be so minor. And so those things will follow that person, right? And shunt them into the system that we're talking about.
I also, as we're all talking about this, and we mentioned earlier that 21 people have died following their incarceration at the jail that we know of. And I say that because the jail will release someone on their deathbed and not count that as in custody, so therefore will not report it to the public. Two men that I don't know off the top of my head, like I don't want to be inaccurate, but I would say about half of them were struggling with mental illness and were incarcerated for their mental illness, whether that's substance use or, something with an SMI, and that killed them. So like Marty Busick presented at a emergency room, he had attempted suicide. He was seeking help. He was desperately seeking help. And he lashed out at a nurse and they sent him to the jail over it. And then he died on suicide watch. It's complicated for me to say how he died because the county is saying one thing, but it's in court, Daniel Pastrick struggled with schizophrenia. He was picked up on a public drunkenness charge, and because he couldn't pay it, it racked up to $600. And he appealed that and wasn't able to he failed to appear at his own appeal because he was disorganized, never had a violent charge in his life. Not that anybody should die if they had one, but I'm just saying this person was a non-violent 63-year-old man who had a clear documentation of mental illness, and we jailed him and it killed him. And I don't know if it's not really, I just feel like I needed to say that too. Like it's, even if you do end up at Torrance and you get this is a life-threatening cycle that's happening. So I just wanted to contribute that.
We're kind of coming on time.
Yeah.
Just in the therapeutic literature, I mean, rapport is actually the thing that works. So I'm pointing back to the kind of the community. Like if your community is that was, if you have rapport with those people, you're gonna get help from the people who you have rapport with. And this is well-known therapeutic literature. And so just like, and people who are experiencing homelessness, part of what they're going through is they have to be outside. I love this one, just keep on walking, just like, let it be, like, don't put gas on the fire. Like they just have to be outside and they're having an issue. You have all these issues all the time. Like you're fighting with people in your house, and no one's, and you don't end up in ACJ because of it. Yeah.
We have one more question.
Just in response to Tanisha, I think the ambulance is such a good example of that. But my question was, why would you all not recommend Resolve? Do they work closely with the police?
I wouldn't say closely, but they work close enough where I would not be comfortable. They've been known to call cops on people. I had someone we were offering support for who, the police was called on him because he seemed violent. It's just not something I personally would do, but I know that other people have had different experiences with Resolve. It's just not for me.
I would just add to that if people don't understand this about 302s in Pennsylvania, the legislation gives discretion to counties to identify some transportation source to serve the affidavits after a 302 petition is approved. But de facto, there is no alternative in Allegheny County. So that means that if a 302 petition goes to the county, is approved, the only entity, the only type of person that can serve the affidavit and transport is a police officer. The main tool at the disposal of a crisis service like Resolve specifically, right, is involuntary commitment. That is a reality that in part just goes back to the state of systems of care in the county, right? So when there is no alternative and you're doing crisis response, again, you have the hammer and you're going to use the hammer. And that hammer is going to use the police. It is not that mobile crisis outreach workers specifically want the police to be involved. It literally is the law in Pennsylvania. And when there's not an alternative, that's going to be used. And so that's why we need to be having those conversations about how we build a fundamentally different system. But we, I think kind of really understanding the limitations and some of that just being kind of baked into the law itself right now. And we have to address that. So
yeah, just for those, I think we did address it previously, but like 302 is the kind of jargon for the section of the law. It's the same law that Brittany and I spent so much time on, Mental Health Procedures Act of 1976. It's the section of the law that deals with kind of, what we've been talking about today is the criminal side of things. This is the purportedly civil side of things, but right. I mean, and, the transport is one thing, but I've, in the reporting we did for this story and also since talked to folks who, the 302 went as good as it could have been. They got to a hospital and then they said, you're fine. Right. Or like, that you were taking a shower and you were reading a book. So we're going to discharge you. And it just starts everything all over again. So I think that to Nev's point, we in our reporting have found that like people at every point of the system are identifying problems. And it's just a whole big mess. I think that we're going to wrap up if nobody else. Oh, yeah. Go ahead.
So as a citizen,
Yes.
what can I do?
Yes.
Except when I'm here, trying not to, trying to give space. What else can we do?
Everybody's like.
To the people who know more.
I'm over here like, what's that going for? No, so a lot of it does mean you're relying on your community groups. So you have to build rapport, with your community members, even, it's not like you're just going to be randomly stumbling upon a ton of people who are experiencing some form of mental episode. These are people that you know already. These are people in your community. And when you build that rapport, you begin to understand
this is, this is just the reality, this is normal for them. Hey, let me, meet them where they're at. First off, that's my number one. We have to start meeting people where they're at. Okay, they believe something a little different that's not happening. Is that dangerous to them? Usually no. So a lot of times we have to A, evaluate our own responses to these things, but B, when it is something that's a little bit outside of our situation, outside of our ability to be helpful, and if they may be in a situation where they're harming themselves, then you have to have community support backups. And I can definitely talk to you about some of the groups that, we lean on as activists. After this, because I don't want to broadcast it to the whole live of the world for safety reasons. But as someone who seems to be actively looking for that, I would be more than happy to help connect you with some of those.
Court watch, I mean,
Court watch is great.
if you wanted to attend
Okay.
these hearings and sit in and just, oh, you do that already, oh, okay.
I never. So yeah.
Well, thank you, everybody, so much for being here. This has been wonderful.
Yeah, we're just it's a few minutes until CMI kicks us out, so.
Yeah, happy to chat. Yeah, perhaps let's wait. Did you have a question, Graham?
No, I was like, not wrong. No, I was just interested in the questions that might have been typed in online that we didn't get to hear.
As far as I know, we had one question about,
We had the one question about law enforcement and their
Right.
role. And then I don't,
Sharing resources.
and then sharing resources, and then I don't know if there's any, there was any, I don't know if there was anything else. Okay.
Yeah.
We had, yeah.
Welcome, everyone.
Good to end.
Oh, yeah.
Live stream. Yay.